Hi, my name is Becky Wilson, and I am going to give a presentation on recruitment and retention strategies in a rapidly changing workforce, focusing mainly on the future. The problem is to recruit and retain the right employees for the right job at the right time to meet current and future healthcare needs. The rapidly changing workforce, it has both millennials that are trying to enter the workforce and the retirement of the baby boomers going on at the same time. Interestingly, the labor force participation rate of women peaked in 1999 and has been on a declining trend. And of course, baby boomers are retiring in large numbers. The Bureau of Labor Statistics projects that the next 10 years will bring about an aging labor force, a decline in overall labor force participation, and more diversity in the composition of the labor force. At the same time the workforce is declining, the demand for health services will be increasing due to the aging population and due to the Affordable Care Act, which will give health insurance to more people. And if you have health insurance, you're more likely to seek out health care. So without adequate ongoing workforce planning, the healthcare system can easily go from an oversupply to shortages. It's interesting, the growth in the labor force during 2012 to 2022 is projected to be smaller than the previous 10 years, when the labor force grew by 10.1 million, as opposed to the 2012 to 2022 prediction of only about 8 million. And also in 2014, there was an estimated 18 million workers in healthcare, with nurses making up 2.8 million of that number. Why is this a problem? Well, multiple reasons. Baby boomers are retiring at the rate of about 10,000 per day. So that leaves a gap in the workforce, adds to the aging population that's going to be seeking healthcare resources, therefore increasing the demand. Hospitals may also, or will suffer, a brain drain, as baby boomers, with all their wealth of knowledge from their career, their long career, goes out the door at retirement. And a lot of new nurses are entering, and other healthcare workers are entering the workforce. Benefits, this is a problem because benefits that were acceptable to long-term employees may not be what today's new workers value or want. They will have to be adjusted. And it's interesting to note that for the first time in history, there are 4 generations of nurses working side by side, from the millennials to Gen X, Gen Y, baby boomers. And they each have different expectations, needs, desires, and so you may have some intergenerational conflict that HR will need to address. And millennials now outnumber baby boomers in the workforce, or wanting to enter the workforce, because boomers, as I said, are retiring. And it's interesting, too, to note that in 2008, the average age of an RN was 47 years old, with 44.8% being over age 50. And if you compare this to 1980, for example, there were only 25% of nurses that were over the age of 50. So aging of the workforce is cited as a reason that the current and future nursing shortage is different and more severe than previous shortages. Implications for human resources. Well, as human resources adopts changes in strategies to meet the change in the workforce, there's many HR laws that still must be maintained, and I just outlined a few here. The FLSA, the OSHA, Equal Employment Opportunity, and HIPAA are just 4 of the big ones. The future workforce, too, will be more technologically savvy, adding some positives to the recruitment procedures, and will need the technology to attract millennials. However, HR will need to be aware of the legal risks of using social media as a recruitment tool. And what I mean by that is that not every job seeker uses social media, and this raises a concern about potential adverse impact on those who are economically less advantaged, which may correlate with certain racial and ethnic groups. we have to also remember that postings are advertisements, so they must include the EEOC or affirmative action tagline. The postings must also be retained like all other hiring documents as required by law. And screening of applicants on social media has actually been decreasing among organizations as concern of the legal risks of discovering information about protected characteristics of the candidates when viewing their social profiles. For example, their age, medical conditions, family issues, that sort of thing. And we have to remember that while we are researching or hoping to find candidates, they are researching us, the organization. Potential employees, they can look online, look up on our website, look at the culture, even find salaries, patient satisfaction, all kinds of data on us. So they are also researching us as a place to work for. So we want to make sure that our website reflects all of our certifications, our ratings, our awards, and everything that goes along with that. And another implication is millennials want a different kind of work than boomers did. They want meaningful work and a quality work experience. They don't just want to come in and do the same thing day in and day out. They want to grow. Human resources, therefore, must partner with IT, marketing, PR, communications to develop a cross-organizational alliance and a shared vision, because HR is integral in staying on top of employee engagement, which will be a key to retaining millennials, and also needs to be part of how healthcare is organized, how the healthcare delivery system is organized, so that they know which type of employees that. Benefits packages will have to be adjusted. What baby boomers want, like I said, and what millennials want could be very different. Ideally, it would be nice to have like a menu of benefits that you would select from. That would be a working solution, but one that would be a large undertaking. But much the way we select our healthcare plans now, you can select plan A, B, or C. We need something like that for other benefits. There should be an assessment done of the current workforce, so to give a baseline of age distribution, specialties, geography, the particular employment settings that people are in. Projecting future growth in supply and demand is very fluid, because it can change with outside influences over which we have no control, such as if the economy tanks, it'll keep baby boomers in the workforce longer. Payers change their reimbursement amounts. And again, as I mentioned before, HR should be involved in how healthcare is organized and delivered, because it's a key driver of demand as well. Changing the way care is delivered due to either QI methods or lean methodologies makes processes more efficient and cost effective, and that will affect the type of providers that human resources should. A strategy for recruitment and retention of the changing workforce. Well, as I mentioned, workforce planning is essential, and it is defined as a systematic process for identifying and addressing the gaps between the workforce of today and the human capital needs of tomorrow. Use of evidence-based workforce development strategies, such as setting a strategic direction, analyzing the workforce, identifying any skill gaps there might be, conducting that workforce analysis, developing, implementing, and monitoring a plan, will all be part of the strategy for human resources. And HR must continue to monitor employee engagement, make improvements where appropriate. Annual surveys might be fine, but there should be ongoing monitoring of engagement via frontline managers would be key in being able to give that feedback. Recruitment procedures must also adapt to today's job seekers. As I mentioned, electronic advertising instead of print ads is where the majority of today's potential employees are going to be looking for a job. So in addition, with workforce planning, it also needs to align with the priorities of the organization and with those of the workforce to make sure that it is meeting legislative, regulatory, service, and production requirements and organizational objectives. Again, succession planning is needed, so retirements can be planned for and workers replaced. There should be a plan in place for that. Automatic screening and talent management tools are examples of new technologies that should be and are being used in the recruitment process. HR must go mobile. Employees want to access their benefits, their payroll, performance reviews online. And HR must become an integral part of the leadership team, as they can have a huge effect on cost reduction for the organization if they know who they're to be recruiting for, what the strategic plans are of the organization, and in their recruitment techniques. Employees today coming onto the job market want a specific scope of work. They want clearly defined outcomes or results. They want to know what they need to do, when they need to do it, and what the result is going to be. They want that focus. Also, I want to talk a little about the development of a culture of retention. And you might say, well, what's meant by a culture of retention? But there was a study that found that nurse managers who were able to develop this culture of retention achieved low turnover rates, high patient satisfaction, employee and provider satisfaction, good patient outcomes, and positive working relationships. How do they do all that? Well, through their daily work, they created an environment where people wanted to stay because they enjoyed their work, and where staff contribute to this sense of attachment. The managers emphasized that they were caring sincerely for the welfare of their staff by their actions. And they forged authentic connections with their staff members, focusing on results and problem solving. So they had an emotional bond to their staff. Some generic retention strategies too would include, of course, competitive compensation, sign-on bonuses, loan forgiveness, and extensive benefits. Also, jobs should be structured so that they are more appealing and satisfying to employees. Assign and group tasks, provide autonomy. Employees don't like to be micromanaged, they want autonomy. Allow flexible work hours and scheduling. That is a wonderful thing. Nurse-patient ratios are very important in employee satisfaction because nurse-patient ratios, if they're too great and there's too many patients to care for, the nurses will burn out and leave. And also getting rid of mandatory overtime. They're key issues. Also making career growth for all healthcare employees a possibility. Nobody wants to feel like they are in a dead-end job. The impact of the strategies on operations, human capital, community, and community stakeholders. You can see improved employee engagement or improved performance commitment loyalty. HR, through technology, can do its basic administrative work faster, more efficiently, saving money. Technology will provide employees with easy access to their information. Training can be tailored specific to employee needs. A menu of benefits. Everybody can pick which benefits that are most valuable to them. This will give the organization a competitive advantage for hiring the best talent. Recruitment costs would be reduced with savings from using technology and having less turnover. Patient, provider, and staff satisfaction will. Also, the community would benefit from having the highest quality providers. Operations would benefit from reduced costs due to technology. Engaged employees are less likely to quit their jobs, thereby reducing recruitment costs. A reputation of being on the cutting edge of tomorrow's workforce for the organization. Employees would have the benefits they want, the tools they need to efficiently perform their jobs via the training. A possible negative impact could be inaccurate projections of demand and capacity, which can lead to either overhiring or underhiring. Increased productivity and efficiency of engaged employees will increase the bottom line of the anticipated cost. HR metrics or a scorecard could be kept to monitor costs associated with the time to fill positions, recruitment costs, cost of training, overtime costs related to vacancies. There's also the cost of technology and its implementation and training, cost of personnel to maintain technology, licensing costs for software, additional staff time to individualize and track benefits of employees, and leadership time of HR to attend various meetings to do with The anticipated benefits and potential consequences, I've just outlined them here, but lower recruitment costs, less turnover, competitive advantage, engaged employees, and meeting the needs of all generation of workers, which I've talked about in the presentation. Some potential consequences: demand and capacity miscalculation, cost of technology may outweigh the cost savings, work-related injuries, illnesses and fatalities, in part due to an aging workforce. As we get older, we have arthritis and our balance isn't what it used to be. So there's more propensity to get injured. Costly chronic medical conditions of the aging workforce, and negative financial consequences as the nature of work transforms and the workforce becomes more health challenged. Conclusion, managing the rapidly changing workforce in healthcare is changing from managing shortages to addressing the demand capacity mismatch. That's the future. The changing demographics must be addressed. Today's workers have different needs and desires. As I've mentioned, diversity continues to grow. We must promote cultural competence to enhance the working relationship. Huge challenge, however, those organizations that are proactive in addressing the needs of the future healthcare workers are the ones that will have success in quality care, quality of employees, and improved financial performance. And as a question, I have, as an HR manager, what do you see as barriers to the proposed recruitment and retention strategies, and what other suggestions might you have to manage a diverse workforce in today's rapidly changing workplace? Thank you very much for listening.